And I'm not a believer in surgery at all. I think there's always an alternative to surgery. I'm a believer in alternative medicine, and if you give the body what it needs, it can heal itself properly. So this was an amazing avenue for me personally, and I've been recommending it to everyone that I know who is experiencing back pain of any kind.
I've had neck surgery, and the neck surgery came out good, but they just couldn't operate on my lower back. They gave me a 50-50 outcome of it.
I had known friends that told me about their friends who had had back surgery and how it limited them afterwards, and recovery time, and that it wasn't a cure-all, plus the danger of a doctor slicing around your spinal column, which is not something I'd like.
I was considering a cortisone injection. I wasn't sure if that would work. I never have had any kind of pain in my life. This was my first time in my life dealing with pain, and it was a real eye-opening experience.
I went into a doctor, actually I went into a surgeon, and he was very honest. He told me pretty much what it would entail, and he also told me, though, if he would have nicked a nerve, that I might not have any feeling in my leg the rest of my life, and it just really, really scared me. I mean, I've never been cut open, ever, and I thought, I surely don't want to do that now. And then I got on the internet and was checking the back surgery, and most people don't, the success rate is really, really low.
The success rate of surgery, 50% or so, was not real exciting to me. I like better percentages than that. And so when we compared with the VAX-D treatment, much shorter recovery time. We were talking 6 to 10 weeks for surgery, and I literally got up and went to Mexico from here.
As a surgeon, I've operated on the back many times. The results were frequently very disappointing. Patients who I thought would get better, whose operations appeared to go very well, had continued pain and were never able to resume their normal active lifestyles or their normal active work. And I couldn't understand it. I started studying about disc decompression, and I realized that as surgeons, we weren't really healing or repairing the tissue. We were taking things out and leaving an abnormal anatomic state. Frequently, this resulted in problems at the disc next to the one we operated on. That became very predictable. I studied the science, and I realized that what we needed to do was to find a non-invasive way to decompress the disc and allow it to heal naturally. We found this in spinal disc decompression. We now are able to, without any surgical incisions, anesthesia, or operation, no prolonged disability time, no time in bed, to relieve back pain, relieve leg pain, and as the studies show, make it last for years and years and years, with no risk of complication and no risk of damage to the adjacent discs.
Exercise therapy and rehabilitation for chronic low back pain has been recommended and widely accepted as a primary treatment for chronic back pain. According to recent reviews, there is strong evidence for exercises being more effective than normal care provided by general practitioners. Studies have also reported that patients with chronic low back pain have reduced muscle strength and greater atrophy or weakening of the back muscles compared with healthy asymptomatic individuals. An increase in muscle strength in the cross-sectional area of the back muscles has been reported after various exercise programs, resulting in increased strength of the spine.
It's just amazing the way I was and how I am now. People tell me that wow, I can't believe it. And it's shocking.
I'm back to my old self again. I feel great, and I don't miss an opportunity to tell somebody how wonderful this treatment is.
I mean, I was limited a lot, and I thought I would have to give up a lot of that stuff, or at least put it off until I can deal with it other ways. But the VAX-D has healed me quickly and successfully.
It really worked. Just that first treatment. I didn't have the pain. I could drive, because I drove here. Could drive home. It was wonderful. Just after that first treatment was just incredible.
It's been 100% success for me. I honestly did not think that I mean, I actually thought that I was going to limp the rest of my life. And I was, you know, resigned to do that. I mean, when you've had back pain for 20 years, you don't expect too much, but it's been just, you know, great.
I'm just enjoying a much better quality of life because I can be myself without the pain, without the drugs. And that's really nice.
We want to thank you for watching. Over the last few minutes, you've heard about the success of VAX-D, the non-surgical treatment for low back pain. Do you have persistent pain in your back, hips, or legs, including sciatica? Do you think you've tried everything but don't want surgery? If you answered yes to any of these questions, getting the lasting relief you need is as simple as picking up the phone. You've got nothing to lose except the pain. Call our clinics day or night for free information and consultation. You don't have to suffer anymore.